I've been seeing more and more content online about scarless lip lifts. I've personally performed over 1,300 lip lift surgeries using my Ella Lift lip lift technique. Are these scarless options actually real? How are they done, and what are the trade-offs? Let's break it down. First, let's go over why people get a lip lift in the first place. The most common reason and the true purpose of a lip lift is to shorten the philtrum, which is this distance here from the base of the nose to the center of the Cupid's bow. And this distance usually increases as we age. Also, some people are just born with a longer distance there, or they might find that it lengthens after a rhinoplasty. So even if they're younger but this distance is longer, we'll sometimes consider a lip lift. Another reason to do a lip lift is to increase the upper lip volume. Some people are tired of getting filler, or they don't want to ever get started on filler in the first place, and they rather do something more permanent to increase their lip volume. Yet another reason to get a lip lift is to increase the upper tooth show. Especially when you smile. Sometimes we get more upper tooth show when the person parts their lips after surgery, like so. We call this the repose view. But even if they don't get tooth show with that type of movement, they will almost always see more tooth show on animation when they smile. Yet another reason to get a lip lift is to increase upper lip arching. Some people start off with a fairly flat architecture to their upper vermilion border, and they're looking to enhance that curvature to give a more youthful, sensual type of look. And the upper lip arching increases because the width of the nose is shorter than the width of the mouth in most people. And because we're lifting at the base of the nose, that's where that action is. And so you usually get this increased arch. Some people start off with quite a bit of arching, and they have to be accepting of the fact that they might get more arching. But that's for a different day. For now, I want to transition into what are these scarless options for lip lifts. But before we get into that, I think it's really important to understand the history of lip lift surgery. It's highly relevant for what people are talking about today, because as we usually say, history repeats itself. And you'll see that here as I show you where lip lifts started and where they are today. And some of the old techniques are essentially just resurfacing in slightly different variations. The concept of a cosmetic lip lift was first described in 1970 by a Brazilian team by the names of Cardosa and Spurley. This was first described as a bullhorn-style lip lift, where the scar was placed at the base of the nose. But the first scientific paper was published in Australia in 1981. This too highlighted the bullhorn style of lift. Direct excision techniques followed, with scars being placed at the vermilion border, sometimes just for the upper lip and sometimes also advancing the lower lip to increase its volume as well. These surgeries of course generate scars right at the vermilion border, which can sometimes be more obvious, and at a minimum tend to blur and fade out the boundary of the vermilion, which can sometimes look more obvious that something was done. In the early 1990s, V-to-Y advancement surgeries were described, and this was meant to increase volume of the lip with incisions hidden on the inside of the lip. We'll explain that more in a bit. The first scarless suture suspension techniques were described in 2011, and that's making a fresh resurgence. I'll cover that more again in a bit. And the endonasal lip lift, which is also sometimes considered scarless, was described in 2014, more than 10 years ago. And these animations here really take you along the journey of how lip lifts have evolved and where the incisions can potentially be placed to essentially achieve similar goals of what we talked about earlier, increasing the upper lip volume, reducing the philtral length, increasing the arching, and sometimes even trying to lift the corners as well. So now let's get into these various scarless lip lift techniques. What are they? Are they truly scarless? Let's go through them one by one. So the first is this concept of a V-to-Y advancement. In general, if you excise a segment that looks like a V and you then go to suture it closed, what you'll find is that the final closure resembles more of a Y shape. And as you do that, you extend and prolong a segment, and that's what some people try to do with the lips. So a scar is present, but it's hidden on the undersurface of the lip, what we call the wet portion of the red lip. This can increase the lip volume, both for the upper lip and the lower lip if that is advanced as well. It's important to keep in mind that this technique does nothing to shorten the actual philtrum. So the philtrum stays at the same height, but you get a fuller lip. But one of the issues with this Vita Y lip advancement is that you sometimes get floppy tissue. And sometimes that's not so obvious in the early setting as you recover from the surgery, but over time, that redundant skin can start to become bothersome to some people. Some people end up biting it when they're eating or speaking, and they've sometimes come to me for a lip reduction to essentially try to counter some of the effects of that fuller lip. It's also possible to get salivary gland injury with this type of surgery because it's a fairly invasive procedure on the inside of the lip where you have a lot of salivary glands. So things like mucocele or saliva that sometimes continues to leak from some of these areas and can be quite troubling to some people is a possible complication, both more temporary and sometimes more permanent in some people who get this type of procedure. And I also find that the volume change from this surgery is less predictable compared to some other techniques. For example, even filler, it's easier to control the amount of volume gained, and it can be somewhat reversible. For people who want a more long-lasting option, they might consider a fat transfer to the lips. That too, in my opinion, is a little bit more dependable and somewhat safer than getting a Vita Y advancement. So again, while there's no obvious visible scar usually on the surface, you definitely get scars, but they're just positioned on the inside of the lips. Now let's talk about another scarless lip lift that is frequently mentioned online these days. And this is the endonasal approach. So the scar here is placed along the alar sulcus and the columella. However, the portion of the nasal sill is placed into the nose. So essentially, you place a portion of the scar to make it less visible inside the nose. And then you're taking the upper lip and you're essentially pulling it into the nose. That is the endonasal approach. So that nasal sill portion of the scar is no longer visible because it's buried inside the nose. But the major downside there is that the nasal sill is essentially obliterated. It's almost completely destroyed because you now are cutting on the inside of the sill and bringing skin forward and removing that skin. So your nasal sill is gone. And that's a very natural, normal landmark. And as the lip is brought into the nose, you lose that natural separation between the nasal subunit and the lip subunit. Usually we talk about trying to preserve facial subunits so that things look as normal as they can. But as you take the lip and put it into the nose, you start to lose that natural division. And what happens ultimately is that nostril show will always increase with this type of endonasal approach. You get this flattening of this area and your nostril show always increases. This surgical approach has been gaining popularity in Korea, and it was recently featured on an account I found on TikTok called Memes. Take a look. And when I went into the comment section, I saw things that were a bit surprising. For example, some people were saying, oh, why do Western surgeons still do this barbaric lip lift when now we have this scarless option? I'll tell you why I still do this barbaric approach, because I like to preserve natural anatomy. I think destroying the nasal sill for a lip lift is not the best approach. And the scarring that you get from a bullhorn style lip lift can be minimized with the proper technique and scar management. And I'll explain more about my technique later in this video. The next scarless lip lift technique making its rounds online is this suture suspension approach. And I got this DM recently on Instagram from an influencer who was wondering if I offer this type of surgery that she saw on some Turkish doctor's Instagram account. Remember, this surgical technique is nothing new. It was described in the literature in 2011 by Echo and Yüksel. They described an intranasal incision being made, so an incision but on the inside of the nose, so that it stays hidden from the outside. There's then dissection halfway down the lip from the inside of the nose. The lip is then suspended with a permanent suture that's anchored to the nasal spine, and that does leave no signs of visible scarring from the outside. Think of it essentially as a closed rhinoplasty. Some of the internal incisions in the nose are very similar to what's done for a closed rhinoplasty when you're approaching the nasal tip or the dorsum without making any external incisions. So essentially, this is like a closed lip lift, if you will. And actually, this technique is usually combined with a closed tip rhinoplasty to create some modifications to the nasal tip while doing the lip lift procedure. This technique does not produce significant upper lip volume gains, which for some people is their primary goal for getting a lip lift. I also have concern about the longevity of this technique, given that everything's being held up by one suture. On the flip side, if you're not happy with the effect, usually you can go in and actually cut the suture out to reverse things closer to how they were before. But one of my biggest concerns about this surgery is that it does destabilize the nasal tip. You're essentially separating the caudal septum, which is the central partition of the nose, from the lower lateral cartilages. When you do that, you cause changes in both the projection of the nasal tip and the degree of rotation. So then you have to essentially reestablish those points of projection and rotation in order to have a normal appearing tip while also shortening the philtrum. So your risk of getting potential cosmetic and functional problems with your nose goes way up when you do this type of suture suspension and complete release of the nasal tip from the inside compared to most other types of lip lift surgeries. And the nasal tip projection usually will increase with this approach unless additional techniques are implemented to try to combat some of that extra projection that you get from doing this suture suspension. The other thing to realize with the suture suspension technique is that upper lip anterior projection usually increases with this approach. But for patients who've had lip filler before and they already have that projection, that kind of ducky lip projection that they're trying to not worsen and sometimes even are trying to completely avoid, that type of increase of anterior projection is really counter to what their goals are in many cases. When we do a bullhorn style lip lift, I've never seen increased anterior projection, especially once the swelling has subsided. The original authors of the suture suspension approach for lip lift surgery advocated for considering this approach for younger patients. They still described in their paper doing subnasal bullhorn-style excisions for their older patients. They didn't exactly describe their cutoff for when they stop doing suspension with the suture and go to excision, but the average age of the patients in that study, if I remember correctly, was in about the mid-30s with a range of up to about 50 years old. So maybe that's the cutoff for those authors. So in addition to thinking of this approach as like a closed lip lift, I also think that it's akin to an endoscopic facelift approach where you can go in with cameras through an incision out here in the temporal region and you can release some tissue and lift the face. And then if you don't need to remove too much skin because it's a young person, that's fine to do. But as people get older and they get more skin laxity, you have to be able to remove some skin. So then your incisions will have to at least partially be based around the ear, for facelift that is. And with lip lift surgery, it's something similar. As people age and they have redundant skin, that skin needs to go somewhere. You cannot just suture suspend everyone. So I think maybe for a younger patient, this could work, though in my eyes, I think you have less control over exactly how much lift you get. There could be a lot of tightness with that permanent suture that's placed that we don't really see as much of with the bullhorn style approach once the internal sutures dissolve. So that is definitely a difference. But I think, again, like with any surgery, there's different techniques and there's kind of a time and place for each one. So while this will not give you a base of nose scar, you definitely still get increased nostril show from all the images that I've seen using the suture suspension, and you get the potential of more changes to your nasal tip and even changes that can lead to difficulty breathing. So some of the external nasal valve can potentially be reduced with this approach. So it's not without its downsides. Now let me tell you a little bit more about how I do my lip lift surgeries. I call it the Ella lift, and it's essentially a bullhorn style of lifting. I do dissect down into the deep plane, so right onto the orbicularis muscle. And it's all about reducing tension on the closure, which allows me to get the best possible scar for each patient. And this surgical approach can be performed for men and women of all ages with very high satisfaction rates. And what I really like about the Ella lift is that there's little to no change to the nose. This is a question that I get a lot from my patients. Will my nose change? So temporarily, of course, with swelling, the base of the nose looks a bit wider, the nostrils can look more open, but then once the swelling subsides after weeks to several months, we find that essentially it returns to almost the same starting position, with very rare lowering of the nasal sill. Usually it comes right back to where it was, especially with, again, the proper technique and the proper deep suture placement. That's not something you can say about the endonasal approach or the suture suspension approach that many are touting as scarless options. I also like that the Ella lift does not increase anterior projection of the upper lip in the long run. So early on, again, with swelling, of course, you're going to see an increase in fullness of the upper lip that will project forward to a degree. But as the swelling resolves, that lip projection is right where it was before the surgery. And many patients, again, ask for that and want that in their lip lift surgery. They're usually afraid of having the upper lip stick out more. So again, that's a very big contrast compared to the suture suspension technique. The other great thing about the Ella lift is that it always will increase the upper lip volume to varying degrees. Of course, the more we remove, the more the upper lip volume will increase. But there's a limit to how much we can remove because we have to think about the position of the teeth, we have to think about the arching, we have to think about facial proportions in general. But again, with suture suspension, you rarely get any significant volume gain. And that's something that a lot of patients, again, when they're seeking out a lip lift, that's one of the primary asks is that they want more lip volume. They don't want to rely on filler as much. And the Ella lift is great for longevity of results. So we see that the impact of the surgery is very much sustained over at least 10 years plus. So some people in the early recovery period might settle out a little bit and realize, oh, I wish we did a little bit more. Well, we can come back in, re-excise the skin, and lift a bit more at the right kind of timing post-op from the first surgery. That's doable. But these days in my practice, my revision rate for removing a little bit more is under 5%. So we usually get it right from the first go around. And if anything, the most common reason for me going back and removing more is that patients were just a bit apprehensive and worried about removing too much in the first procedure and maybe actually asked for less to be removed than even what I recommended. And then, of course, there's a higher chance of us coming back to remove a bit more. But in my eyes, I think it lasts longer and is more predictable than suture suspension surgery. And then let's address the elephant in the room, which is that with the Ella lift or any other bullhorn approach to lip lift surgery, we always get a permanent scar at the base of the nose. And you may have seen online that sometimes these scars can be problematic. You've probably seen a lot of railroad vertical types of marks along the scar that can be a very wide scar with these vertical lines that looks not great, right? So how do we avoid that? How do we minimize the chance of that type of scarring? And a lot of that is based on the actual surgical technique. So I'll give you some of the tools and tricks that I use for essentially trying to minimize scarring. That's a big reason why people come to me, because they want to have the best possible scar. Now, of course, some people are prone to hypertrophic scarring, for example, and no matter how good the surgery is, they still might get a slight raise to their scar. And then we we might need to treat it with steroids and laser resurfacing, but that's a minority of cases. So first is careful handling of tissues. Some people say, well, how's your technique better? Like, what makes it better? How is it better? And it's kind of hard to sometimes explain to people, but this is a delicate area, right? So how you handle the tissues, how much force you put on the tissue with your forceps is extremely important. Where you grab it, how you grab it, minimizing the times that you grab the tissue is of course going to impact on the final results. So for the nasal side, for example, I use a lot of hook techniques. So I use a small little double prong hook on the inside of the skin that puts no pressure on the actual skin edges. And that again helps with the ultimate healing. So how much you squeeze, each time, and the caliber of your pickup, for example, all of that is so important when it comes to final outcomes from lip lift surgery. The next is the use of tapered needles. So what I found after doing a lot of these procedures is that if I use tapered needles where the needle is only sharp at its very point, that gives me a lot more control and less damage to the tissue compared to using a more standard cutting needle, where the entire surface of the needle is sharp. In this very delicate area with friable tissue at the base of the nose, if you use a cutting needle, you're just going to be tearing through tissue, and that's not going to be great for recovery. And also, if you want to have the perfect grasp and the perfect leveling between the nose and the lip when you're suturing, it's helpful to have that needle be tapered. These needles are more expensive. They're sometimes a little bit more challenging to work with, and that's why a lot of surgeons don't offer it with these tapered needles. The other thing I do to optimize healing of the scar is to create a skin muscle flap. So what that means is that once the skin is removed down to the deep plane, the skin that we excise with this bullhorn approach, I then elevate a flap. So I separate the skin from the muscle going down, not necessarily all the way to the vermilion border, but enough distance where we start to reduce that tension. And then we have the skin separated and we're able to place our deep sutures into deep positions within that elevated flap that will again lead to less tension on the skin itself. And when it comes to the deep sutures, I use a suture that is both strong enough to, of course, support the healing in the first few months, but won't linger around for a very long time and cause spitting and suture abscesses that I used to get in the early days of doing this procedure when I had a different type of suture. Now I use something called monocryl, and I'm able to place that deep suture deep enough away from the skin surface, and I'm able to place it in a way that the nasal side and the lip side are well matched as far as leveling. That's very critical for having a very nice, even healing at the actual skin surface. And I used to think that those vertical scar lines that you see sometimes after lip lift surgery were from just increased tension at the actual skin surface, that the skin sutures were tightened too much, and that's why they got those lines. And now I realize that that isn't actually the case. The real reason is that there's too much tension on the deep suture. So by placing that deep suture into, at minimum, the deep dermis or into the subcutaneous tissue, or the SMAS layer, that will give you better results on the surface as far as healing than having that deep suture right under the skin surface that will then basically strangulate that skin and not allow it to heal as well as it possibly can. So that is, I think, a big misconception, even amongst plastic surgeons. They think that those vertical striated scars are coming from the surface stitch. I would disagree with that. I think it's actually coming from the deep stitch improperly placed. Of course, when you place the surface suture, it's important to have really careful tensioning of those stitches because, again, you don't want to over tie the stitch. You don't want to overly kind of cinch it down. So you want it to properly approximate the skin edges, but you don't want it to hurt the skin. And so we say in plastic surgery, oppose but don't necrose. And as far as that skin surface suture goes, I use Prolene, which is the only true permanent suture, so it does not cause an inflammatory reaction from the body, and we leave that suture for 5 to 7 days. I never use absorbable sutures at the skin surface. And as far as scar management postoperatively, we do favor scar gel. Usually that starts about 10 to 12 days after the lip lift, and that scar gel is applied twice a day as the base coat, with anything like concealer or moisturizer or anything else being placed on top of that base coat of scar gel. That's going to optimize healing, especially if that scar gel is applied for a full year. Minimizing sun exposure is very important. Minimizing movement of the upper lip, especially in the first 2 weeks post-op, is so critical. And coaching and guiding patients as to how to best do that, I found to be really important in recovery from lip lift surgery. And sometimes when I'm doing a lip lift and I notice that the skin is quite thick, what I'll do is that I'll introduce Kenalog, which is a steroid that I'll inject right at the end of surgery to try to reduce the potential of hypertrophic scarring. And at the earliest signs of hypertrophic scarring, which usually doesn't settle in for at least the first 4 to 6 weeks if someone is predisposed to that, we'll bring people back and we'll start more steroid injections. And we'll continue steroid injections because we want to stay ahead of it and we want to try to flatten that scar as quickly as we can. These injections can be repeated monthly until the scar is flat. The scar always goes flat. I've never had a hypertrophic scar that I couldn't flatten with steroids. We have different intensities of steroids that can be used when needed. And then once that scar is flat, if it did get hypertrophic, those are the patients that are most likely to benefit from laser resurfacing of their scars. But I usually don't recommend laser resurfacing too soon after surgery, so waiting something like 9 months to a year until that scar is more mature is, in my opinion, a better time to then get resurfaced. But again, the vast majority of my patients just simply rely on good surgical technique and scar gel for their post-op scar management. And very few end up getting laser resurfacing or have a need for steroids. That's going to be a small percentage of patients, maybe 1 to 2% of patients getting lip lift surgery with me. So don't be swayed by the latest social media trends. Keep in mind that a lot of these new techniques have actually been around for a very long time, and there's a reason why some techniques never really gained a whole lot of popularity or were popular at one time and then faded out. And that's something to keep in mind when you're assessing, is this surgery truly scarless? And if it is scarless, is it really better than a different type of approach where I might get a scar, but at least I don't have any other distortion to the area? That's something to really keep in mind, especially for a person who's very concerned about any nasal changes. Sometimes a scar is the lesser of the evils.